Everybody, and welcome to this revision video where I go through specific brain and neurological injuries and illnesses. This is part of the neuropsychology topic for stage 1 psychology. So let's get started. Starting with amyotrophic lateral sclerosis, or ALS. So this is a progressive neurodegenerative disease that weakens the muscles and impacts physical function. So motor neuron disease, or MND, which you may have heard of, is one of the most common types of this. It's also referred to as Lou Gehrig's disease, if you've heard of that reference as well. So it affects the nerves in the brain and spinal cord, causing muscles to waste away. So essentially the motor neurons, which we've talked about in a previous video, are unable to get to where they need to go in the body, so down the spinal cord and obviously then to the surrounding muscles. Because of that interruption in the neurons being able to get where they need to go, it will cause the muscles to waste away because the messages are not being transmitted properly. So ALS impacts motor neurons, as I've said, the nerve cells responsible for coordinating movement. So the brain has difficulty initiating and controlling the muscles. Unfortunately, and eventually, ALS will impact the sufferer's ability to speak, eat, move, and breathe, which obviously relies on motor and sensory neurons. Here is some information about motor neuron disease in Australia. So ALS is the most common form of motor neuron disease, as I've said before. Stephen Hawking, a very well-known sufferer of motor neuron disease, you may have heard of him, was diagnosed when he was only 21 years of age. But despite his disorder, he pursued a university education, receiving a doctorate in applied mathematics and theoretical physics at age 24. So he only had a life expectancy of 2 years in 1963, but he lived a full life before passing away in 2018 at the age of 76, which is remarkable. So in the 1960s, he began using a wheelchair, and in 1986 lost his ability to speak. He then started using a computer program called the Equalizer to speak for him. So in more recent times, and here in Australia, the fight against MND has been spearheaded by Neil Danaher, who was a former player for Essendon and Melbourne Football Club coach. So the Big Freeze, which you may have heard of, is in recognition of trying to raise funds for research to fight MND. So he was diagnosed in 2013. He's been a prominent campaigner for MND research ever since, as we know. So Fight MND is a charity that raises money and awareness for the disease, and the annual King's Birthday football match between Melbourne and Collingwood here in Australia features the Big Freeze, where celebrities will slide into a pool filled with ice and water. And to date, over $50 million have been raised through these initiatives to try and find a cure for motor neuron disease. So now looking at plegia. So plegia refers to paralysis of the skeletal muscles caused by damage to the nerves that control them. So it's important to note here that the actual limb itself is fine. The actual damage is the nerves or the spinal cord that control them. That's actually where the damage has occurred. So this damage can occur either in the brain, the spinal cord, the peripheral nerves, as I've said before, that surround the central nervous system. So the damage to the nervous system could be caused by lots of things. So it could be a stroke, a traumatic brain injury, tumours, disorders such as multiple sclerosis or muscular dystrophy. And according to the National Spinal Cord Injury Statistical Centre, since 2015, 38.3% of spinal injuries have been the result of a vehicle accident, and 31.6% have been from falls or falling from a height. So some other common causes include violent crimes, sporting accidents, etc. And the type of plegia suffered depends upon the location and the severity of the damage to the nervous system. So let's look at some examples. So paraplegia refers to paralysis in the legs with the arms still maintaining motor functioning. So it's typically caused by injury to the spinal cord towards the lower back and hip area. As you can see here, paraplegia pictured here. Then we have quadriplegia, which is a form of paralysis that affects all 4 limbs as well as the torso. So quad meaning 4, so all 4 limbs, hence the term. Usually caused by damage high up in the spinal cord above the level of the arm, so very common in neck injuries, unfortunately. So the higher up the injury, the more of the body will be impacted by this paralysis. Then we have hemiplegia, which refers to paralysis that only affects one side of the body. So one half, as pictured here. So hemiplegia is often caused by strokes, aneurysms, and blood clots in the brain, and the opposite side of the body to the site of the damage is impacted. So when I did my brain video, my previous video, we know that the left hemisphere controls the right side of the body and vice versa. So whatever part of the brain or whichever hemisphere, hence the term hemiplegia, is damaged, will cause difficulties in movement on the opposite side. And then we have monoplegia, which refers to paralysis that is restricted to one limb. So mono means one, hence one limb. So again, hence the term. So usually an arm or a leg. This is often caused by cerebral palsy or a sporting injury. Okay, multiple sclerosis, or MS, as it's often referred. So this is chronic and progressive disease of the nervous system, where the body's immune response attacks the myelin sheath, all right, which is the fatty protectant that covers the axon of our neurons, as mentioned in my neurons video. So MS causes permanent damage and deterioration to the myelin sheath, impacting the ability for the brain to communicate with the rest of the body, because we know the axon is responsible for the electrical message then being passed on to the dendrites at the end, or the synaptic buttons, I should say, at the end of the neuron to allow for transmission. If that myelin sheath is damaged, the message is unable to get through effectively. So common symptoms of MS include feelings of numbness, weakness, and tingling in the limbs, a lack of coordination, mood disturbances, and difficulties with vision, which can include partial or complete loss of sight, usually in one eye at a time. So while there's no cure for MS, there is a lot of treatment options, and they focus on slowing the progression of the disease and managing the symptoms that it causes. Okay, Parkinson's disease. So this is a brain disorder that causes difficulties with balance and coordination, as well as uncontrolled shaking movements. So Parkinson's disease is caused when neurons in the brain that secrete dopamine, our neurotransmitter, actually die, thus reducing the amount of dopamine available for use in neural pathways. So we know that dopamine is responsible for us feeling good, and it's part of our reward system or pleasure system that we feel in terms of emotional control, but we also know that dopamine is responsible for movement. So when these receptors, so the neurotransmitter dopamine receptors die and the neurons die, that means that we're unable to coordinate movement properly. So it leads to a loss of control of bodily movements in patients. So another important neurotransmitter is noradrenaline. This is used in the neural messaging of the sympathetic nervous system, or the sympathetic neurons, I should say, in the flight or fight response. And in Parkinson's sufferers, nerve endings that produce noradrenaline are also damaged, which leads to reduced level of the neurotransmitter noradrenaline. So there is no cure for Parkinson's disease, but there are medications that significantly improve symptoms and quality of life for patients. So now we're going to look at some case studies of significant brain injuries, illnesses, and traumas, which has really revealed a lot about what we do know now about the brain and localization, as well as neuroplasticity, which is the brain's ability to make new connections and recover after illness and injury in some cases. So starting with the tragic death of Phil Hughes. So he was unfortunately killed in 2014 by a ball to the cerebellum part of his head and neck. So he was struck in the cerebellum area by a ball, which is responsible for consciousness. So the official cause of death was intracerebral hemorrhage. The ball itself was traveling at about 135 kilometers an hour, and the impact of the ball caused the vertebral artery to be compressed and split. So when an artery is split, this is called a dissection. That then forced blood into the brain area and caused him to lose consciousness very, very quickly. And unfortunately, because of that damage, he passed away from that head injury. So we know that the hindbrain is made up of the cerebellum and obviously the medulla and the pons, and because it was the cerebellum area that was struck, we know that's responsible for movement and consciousness. So that's why he lost consciousness very quickly and unfortunately succumbed to his injuries. We also have the very famous story of Phineas Gage. So he's one of the most famous patients in the history of neuroscience. So he was a railway worker who in 1848 suffered a head injury caused by a tamping iron, so a long steel pole that looks like a javelin. It's a little bit shorter than a javelin, but it's got the same sort of shape, being blown upwards and Gage being in the blast zone. So the tamping iron entered the left side of Gage's face through his cheek. It then moved diagonally through his head, behind his left eye, and exited through the skull through the frontal lobe. So the tamping iron itself was found landed 25 meters away after the initial blast. So the force of this injury caused Gage to be thrown onto the ground and suffer seizures. However, within minutes, miraculously, he was able to speak and walk with some assistance. He then took himself to the doctor after sustaining this injury, which is remarkable. So upon presentation to the doctor, he was conscious. He did not appear to be suffering from immense pain. He recognized the physician and spoke very coherently with him. And this was despite the doctor having to remove numerous bone fragments from the wound and noting that a portion of his brain was protruding through the hole left by the tamping iron. So it was remarkable that this did not kill him straight away and was able to resume some normal functioning. So his recovery, probably not surprisingly, was slow and very variable depending on the time of day, and there were a lot of difficulties that he encountered. So his recovery was very slow and spasmodic. So he went through periods of delirium, an altered state of consciousness on occasions, again depending on the time of day, where his behavior was irrational. It often was very childlike in some instances. He also suffered weakness in some parts of his body and experienced poor memory. Approximately 1 month after this injury, however, he was able to walk and talk with many mental functionings returning. So that's what we call neuroplasticity. So when the brain is able to recover and make new neural pathways in order to recover itself and maintain somewhat of normal functioning again in that particular site of the brain. So Phineas Gage lived for another 12 years after the tamping iron pierced his brain. He did die in 1860 after experiencing a series of convulsions brought on by the injury itself. So epilepsy was recorded as his cause of death. And Gage's skull and the tamping iron itself that caused the injury were donated to the Warren Anatomical Museum, owned by Harvard Medical School, and as you can see here, are still on display to this day. So he was a very important figure. Through this tragic accident, we learned a lot about different localization and functions of the brain. The fact that his frontal lobe was damaged explains now to us why, if I just go back for a moment, his behavioral changes. So we were able to make conclusions that behavioral changes, personality, etc., must be localized to the frontal lobe. So we were able to make a lot of conclusions based on this tragic accident. Okay, moving on to patient HM. So probably one of, if not the most famous figure in neuropsychology. So HM is what he was referred to. He suffered a lot of epileptic seizures. So his actual name was Henry Moliason, but again, more commonly known as HM. He actually underwent experimental surgery to remove part of his temporal lobe, so the hippocampus in particular, as you can see here. So this caused him to experience a severe memory impairment, which was studied for over 50 years before his death in 2018. So initially, his epilepsy was presented after he was knocked off a bicycle at 7 years old and sustained a head injury. So in the subsequent years, his seizures became more and more severe, so became much more worse. And it resulted in HM being unable to maintain a job or live a normal life. So at the time of the removal of the temporal lobe tissue, there was a procedure used to treat psychotic patients. So it was very similar to that of a lobotomy, if you've heard of that procedure before. So lobotomies were common back then, and an experimental surgeon thought that removing the hippocampus of HM will definitely alleviate the symptoms of epilepsy, but they weren't really sure what would happen after that. So this surgery was purely experimental to see what would happen. So HM accepted the proposed treatment as a last resort. So the procedure worked to relieve HM of his seizures. However, his memory was profoundly impacted. So he could not retain memories of the current day. He forgot his own birthday. He could not recall names of people he was recently introduced to. He did live to be 82 years old, and his experience have been integral to the scientific understanding of the temporal lobe and its formation of memories, specifically the hippocampus. Then we have Broca's aphasia. So Broca's area is a location pictured here in the frontal lobe responsible for both language production and comprehension, or speech. So in 1861, French doctor Pierre-Paul Broca, hence the term, visited a patient who had suffered from a degenerative speech disorder for over 20 years. However, his mental functions and comprehension of speech were unaffected. So upon the patient's death, Broca noticed damage to the frontal lobe in a region that became known as Broca's area. So this finding led to the understanding that Broca's area was integral to the formation of sentences and the production of logical articulate speech. So Broca's performed many more autopsies on patients suffering from the same symptoms. So hesitant and fragmented speech, in other words, and continued to confirm trauma to the same areas of the frontal lobe. So this condition became known as Broca's aphasia. Okay, so chronic traumatic encephalopathy. So Aaron Hernandez was an American footballer who was a very famous case study on this condition, also known as CTE. He played for the Patriots in the NFL. So he suffered multiple concussions and head injuries throughout his life because he was a professional NFL player. As a result of this, he started engaging in violent and antisocial behaviours, leading to his conviction of murder in 2013. And an autopsy of his brain showed very severe degeneration of brain tissue, a condition known as CTE, as I've said before. So this is often seen in athletes who have suffered multiple concussions or strikes to the head. So this is chronic traumatic encephalopathy. Sorry, I said it incorrectly before, so encephalopathy. So you can see here is a normal brain, and then this is advanced CTE. So you can see a very dramatic change in the structure. And this is the concern with multiple concussions being sustained in individuals. It will cause, obviously, brain functions to decrease and lead to more antisocial behaviours, as we can see here. There is a lot more research that needs to be done into CTE, but there is a lot that we can learn from this particular case study of Aaron Hernandez. And just to finish up as well, there is a direct correlation between brain damage and criminal behaviour. So all of these people listed here are convicted serial killers or engaged in murders or very antisocial behaviours, and all of them had sustained either one significant or several significant head injuries throughout their life that may be the cause of their judgment and their impulsive or lack of impulse control that led them to commit their crimes. So looking at this visual here, traumatic brain injury amongst adult male prisoners, half of those had used drugs at the time of their arrest, which we know affects our brain and our functioning. Over 2/3 had their first brain injury before their first offence, and over 3/4 experienced more than one brain injury. So there is a direct correlation between brain damage and criminal behaviour. So I hope you found this video useful. As always, if you've got any questions, shoot me an email or come and speak to me in class. Otherwise, happy revising.